Welcome to the Weekly Dose Podcast, your one-stop shop for the weekly news in incretin mimetic therapies, with your host, ManOnMounjaro, Dave Knapp. Welcome to this special weekend edition of OnThePen, the Weekly Dose. I'm Dave Knapp, ManOnMounjaro. That's why I'm here. You are on the pen. That's why you're here. And we're here to talk about an interesting topic from some news that came out actually at the end of 2023, which we haven't covered very closely on this channel. And I want to highlight it for the purposes of how this all plays into the importance of Eli Lilly capitalizing on the tirzepatide supply in the form of releasing tirzepatide, Zepbound, MOUNJARO in other presentations to bring more product to market. So this is a really interesting story. Roche, which is a pharmaceutical company, probably best known for Tamiflu, though they have a lot of therapies in the cancer and oncology realm. And I find this information really fascinating because I did not know about this other company involved. So Roche announced that they were going to purchase Carmot Therapeutics. And Carmot Therapeutics has 3 obesity and diabetes investigational molecules that are of particular interest. So this would get Roche into the GLP-1 incretin mimetic space and in a really big way. So they have 3 assets that I really want to highlight for the purposes of this video. And then I want to talk to you about how I think this just puts a little bit more pressure on Eli Lilly to capitalize on the assets they have on the market right now, specifically tirzepatide, in order to maximize and extract as much value out of those medications as well. So another sort of business case for releasing the vials, increasing the supply. Again, I don't think that we've said what we can from the patient perspective on the Release the Vials campaign, right? There is a business case to be made. And so I just want to talk to you a little bit about how this Roche acquisition of Carmot Therapeutics plays into that. So 3 assets. We'll cover them in order. There's CT388. So CT388 is a dual GLP-1 GIP. It's a straight up sort of head-to-head with tirzepatide, which is the same thing, GLP-1 GIP. Now, this is in phase 2 clinical trials, and this one saw significant weight loss, 8.4% weight loss after just 4 weeks, which is a huge number after just 4 weeks. And these results suggest that this formulation, CT388, could actually be a more potent or perhaps a better ratio GLP-1 to GIP. The bottom line is just could be a better molecule than tirzepatide. Now, again, this is way off. This is, we'll probably have retatrutide. We'll definitely have retatrutide before we ever have this medicine. But a very interesting one that's a once weekly injection. Then we have CT868. Now, this one is interesting because this one is also a dual agonist, a GLP-1 GIP. But with this formulation, it is a once daily injection. Now, this on the surface sort of seems like a step backwards, right? Like, why would you go to a once daily for convenience sake when you could just take it once weekly? Well, I speak for somebody, as somebody who I feel like my body metabolizes the once weekly shot perhaps a bit quicker than others do, whereas the effects start to wane after about day 2. There's a significant drop off in not only my appetite suppression, but in my glucose control as well. So perhaps that once daily shot might be a better option for those who maybe need a more continual dose of the medication versus just that once weekly shot. So that's one possibility. I think that the focus on this particular drug is for diabetics with obesity. And so as that one is in phase 2 trials, it will be interesting to follow that one as well. It could perhaps, for people like me, diabetics, see better numbers in both the A1C reduction and the weight loss versus tirzepatide. Again, this is a GLP-1 GIP coagonist. And then the third one is a small molecule pill, right? Where else have you heard that? Orforglipron. Eli Lilly has their small molecule pill, which they expect to hit the market in 2026. They're already building manufacturing infrastructure. Small molecules are a little bit easier for the body to extract the bioavailability, right? We see with semaglutide in the form of Rybelsus being a straight peptide pill, is just hard to get the body to absorb that efficiently. So that's why you see the big jump this year. Later this year, we'll go from 14 milligrams to an available 50 milligrams of semaglutide, whereas the highest dose available currently on the market of the injectable is 2.4 milligrams. So that's a huge jump, and that's because of the bioavailability. The small molecule just presents a little bit better bioavailability, so there aren't so many rules as to when you can take it and how you can take it. The other thing is just manufacturing, right? Being able to manufacture something that is not in a pen, that doesn't require cold storage. It's just a cheaper medication to bring to market. And so this will be an interesting one to follow. It's a small molecule that will rival orforglipron. And it sounds like with some early feedback on this one that it could be even better than orforglipron, but we don't even have final data on that one yet. But I mean, I think what's interesting here is you see two assets that go right up against two of Lilly's blockbusters. Now, Lilly also has retatrutide in the pipeline, but that has not been approved yet. It doesn't finish phase 3 clinical trials even until, I believe, early 2026. So we've got a ways to go on that one as well. But you see the printing press for Eli Lilly, it is got an expiration date on it, right? I mean, effectively what you see is they have to capitalize on tirzepatide now, because this is just one company with a daily and a weekly and then an oral that will rival tirzepatide, Zepbound, and MOUNJARO. And even though we're a couple years off, like now's the time that they have to capitalize on it. Like every month that goes by where this medication is in shortage and they're not getting people on the Lilly platform for incretin mimetics is just a lost opportunity. So if you think about it in terms of the future of what will be on the market and, you know, building brand loyalty and all of those things from a business perspective that you consider, it's so important to get people on the platform right now. Again, just making the business case, because of course this is not the only one. You also see Viking Therapeutics with VK2735. That is an amazing medication in the pipeline there with Viking Therapeutics. They've got a lot of challenges and hurdles that they'll have to meet, especially as it relates to manufacturing, right? We've heard some interesting things from their CEO about what they're planning to do, or rather not planning to do, as far as it relates to building infrastructure to make VK2735. Also, that one hasn't even started phase 3 clinical trials yet, but that one you see a GLP-1 GIP, and they'll have a pill form version of that too. Just think about how revolutionary that would be to have a GLP-1 GIP. So basically tirzepatide, a GLP-1 GIP variant on the market that is in pill form. It would be so much easier to bring that medication to market. And so it'll be interesting. Perhaps you see Viking Therapeutics bring the pill to market before their shot. You know, a lot of it will depend on how much of the manufacturing infrastructure in the world has been gobbled up by Eli Lilly and Novo Nordisk, who again are, their GLP-1s are a printing press of money right now. So whatever they can buy, whatever infrastructure they can buy up, whatever they can build, they're doing it. And so it's going to be very hard for these sort of late to the game GLP-1 incretin mimetic drug manufacturers to actually have the capacity to build it out or gobble up existing manufacturing capacity to make these medications. So the pill versions of these, I think, are really where the biggest threat comes in the nearer term, right? None of this is near term, but as in terms of when these drugs hit the market, late 2020s, right? Early 2030s, which is a crazy thought to think about. But I think about just, I started covering this information in 2022, right? And we're already at 2024, and it seems like I just started. That's 2 years, and it flew by. So it'll be interesting to follow these ones. We will follow these closely as the clinical trials advance. Again, for those who are interested in looking these up on their own, you've got CT388, which is their weekly GLP-1 GIP. You've got CT868, which is their daily GLP-1 GIP. And then you have their CT996, which is their daily oral small molecule GLP-1 pill. All of these, I believe, advancing to phase 2 clinical trials currently, now all under the umbrella of Roche Pharmaceuticals. So you'll have to check that out. Again, this acquisition was announced in late 2023, but implications are far-reaching, and we just hadn't covered it that closely on this channel, and this is the first that I really have learned about these medications. So hopefully you learned something new today. If you did, consider liking, saving, sharing this video, and definitely make sure that you subscribe to the channel. If you're listening to this on the podcast, give it a 5-star rating and review. I hope that you enjoyed this. I hope that you have a great weekend. Thank you for being along for the ride with me here at On the Pen, the weekly dose. And until next week, we'll see you on the pen.
Welcome to the